The risks to the babies from the laser ablation are primarily the possibility that it either doesn't work and the twin-twin continues, and therefore the babies are still at significant risk, or indeed the laser works and the twin-twin resolves, but because we've done an invasive procedure, the mother can miscarry, and that can be up to 4 weeks after the procedure. Those are the two main risks. However, in terms of the other risks, assuming that the laser works, the other main risk is really to the smaller baby, the donor. And that is because when you block off the blood vessels that connect the two parts of the placenta together, you potentially can leave the donor baby with a much smaller share of the placenta. And because that baby is no longer sharing the other part of the placenta with its twin, the placenta that baby has may be just too small for the baby, so the baby doesn't grow afterwards, and potentially can have severe growth restriction, or indeed die because it just hasn't got enough placenta to grow, and that may be several weeks after the laser is performed. The final risk that the baby takes is that, I'm sure anybody who has children knows that when you're trying to do something, the babies want to get involved. And babies with twin-twin are exactly the same. So when I'm performing a laser, I will often find that the recipient baby whose sac my laser fibre is in will try and get in the way and try and move the fibre. And it's amusing when we're doing it, but actually it's quite a significant problem, because if I were to fire that laser onto the baby's skin, because the baby put its hand or foot in the way, then that can cause a full thickness burn, and that can potentially cause a severe problem for that baby because it's in such an early part of development. So we have to be very careful when we're doing the lasers, and this is a part of the skill development that happens when we learn the laser procedure.